Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we'll be talking about compounding pharmacies and the process so you can add this to one of your tools in your clinical practice. So Kathy, at Wellist, we love having this service that you provide. So can you kind of tell us your process in finding a reputable compounding pharmacist so that you can help other nurse practitioners add this to their repertoire?
Absolutely. So I should say that as of January 1st in the state of Massachusetts, nurse practitioners finally got full practice authority. So that really opened up a lot for us.
Mhm.
You can absolutely get a supervising physician. I just think it's a really wonderful thing if you don't have to have that. And so um, it's a great question about how to. I didn't know anything about compounding at all and was afraid of it because what we hear so much about is, it's not regulated and all of the things around the bioidentical hormone replacement therapy and all of that. And there's just so much, I think, misinformation around that. And so that certainly guided me, and I was very afraid of the whole thing.
Mhm.
So I was fortunate in that I found two really wonderful um, compounding pharmacists that I could talk with. One, we both have a wonderful mentor, Heather Cox Quayle of the Show Center, and she does a lot of compounding work. And she connected me with her pharmacist that she works with at Innovation Compounding Pharmacy. And then at Wellist, our clinic in Boston, we had a patient who's was connected with a local compounding pharmacist. So I was able to talk with both of these women about like what is compounding pharmacy and how do you come up with you need like different recipes for the prescriptions and all those kinds of things. So I
Mhm.
think that's the first part is finding somebody. You could even start with like a local compounding pharmacist in your community and then chatting with them. And I will say it's still very helpful for me to have Heather as a mentor
Mhm.
when I'm trying to think about
Yeah,
more of the recipes and things like that.
yeah. And I think I remember you saying it was super helpful to have at Innovation, they have, all the research articles and things, resources for you to read,
Yeah,
and just very easy to talk to Tara Thompson about all of this stuff. And she's an
right.
amazing resource in and of herself.
Absolutely. And she's I think the head compounding pharmacist. She goes by the sexual health pharmacist, I think. And absolutely, Melissa. So I think especially as NPs, we really want research to guide our practice.
Yeah.
And, I think like an advantage of some place like Innovation is that I think they're probably a bigger
Mhm.
organization than the local, like maybe a smaller local pharmacy. And so when I said, could you give me all your research articles on the use of estriol, which is a different kind of estrogen that I didn't really know about before I started this whole thing. They were like, sure. And then it was like all online and
Yeah,
like
it's great.
very easily accessible. And that made me feel a lot more
Yeah,
confident. They also, I think when you're looking, um, I also liked that Innovation had everything's online.
yeah,
Like you can do the ordering online,
yeah.
all
Makes
the
it easy.
resources are online. Now, I will tell you that I still call. I call in my prescriptions because I like to go over it with the pharmacist and make sure. I like to talk through starting dosages and things like that.
Hmm.
Yeah.
Yeah. And, as a pelvic floor physical therapist, I see all the time how helpful sometimes that compounding stuff can be, because it can be so helpful for
Totally.
vestibulodynia, where you're really working on specific muscles, but they really need, whether it's just like some extra hyaluronic acid or the estriol, that can make such a big impact on their healing. So it's a great tool to have, and
Or the
something that NPs
testosterone,
can
right?
really, yeah, totally. Cool.
Yeah. And I think we're using it in such small dosages that
Yeah.
there's no fear, right? And I think that's what, as soon as you chat with these compounding pharmacists and they provide you with the resources, you're like, oh, and then you can really, it's like a whole additional way to be able to help your patients. And it's really fantastic.
Yeah, cool. And I know that you were so particular too about what they're compounding it in, because that's such a
Yeah.
problem too, and can be really irritating to patients if the
Right.
um
Absolutely. And so also at Innovation, when I said, what do you compound them in? And can you send me the ingredient list? Because we will have patients that are going to ask,
mhm,
again, all online, like all online. Not that a smaller place couldn't do that, but I just think if it's something that you're adding in and you're already a busy prescribing clinician, sometimes it's nice to just have it like
yeah,
right at your fingertips. And also something I didn't know is that you can some of these compounding things, like you can put them in coconut oil, you can put them in olive oil. Like it's really interesting. And I certainly learned a ton. And then I learned a ton about the kind of bases that they
yeah,
use, and certain ones that are very good for adhering to mucosal membranes, and some ones that are like aqueous versus non-aqueous. I didn't
yeah,
know anything about all of this. So I feel like having a compounding pharmacist as part of your team especially when you're doing women's health, is key.
yeah, definitely. Cool. Well, thank you for sharing.
Yeah,
And
totally.
And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges with incorporating compounding medications into your practice.
And subscribe to our email list at instituteforpelvichealth.com to get our free guide, 4 tips for managing your challenging pelvic exam. And you'll get access to our free weekly pelvic health content.
Be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce that we're developing an online pelvic health course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Now let's revolutionize pelvic health. We'll see you soon.